have another doctor in there.
I think they did the first time. I've seen it. I know. It's hilarious.
Yeah,
6 on the high.
sounds crazy, pants.
When Dr. Connor, I bought his breakfast.
So you
Are we ready, folks?
Yeah, but I joined it. Bigger group.
And I did break a record.
What's that? The
Are we
group.
all good?
We're the only one in Terre Haute.
Good evening.
Places going.
Good evening, all. How about if we call the meeting to order? And could we all rise for the national anthem, please? And the pledge of the flag? Pledge of allegiance.
To the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Okay. Roll call, Rhonda?
Jeff DePass,
Yes.
Dr. Turner,
Yes.
Dr. Todd,
Yes.
Dr. Lim,
Yes.
Dr. Caddick,
Yes.
Dr. Ross,
Yes.
Mr. McCannon.
Present.
Our next is approval of the minutes from the last meeting of July 21st, which is an action item. Do I hear a motion?
So moved.
Second.
A motion is second. All those in favor?
Aye.
Opposed? The action item passes. Rhonda, financial report, please.
As you'll see, it's there. One of the things I want to point out to you is our immunization grant. And what happens is in June 30th it ends, and then July 1st it starts. There's always monies that has to be moved around and done. So as you'll see, I'll have one account for 8109 and then another for 8119. So I've got to contact them on Monday to verify how they've got that set up. Okay.
Any questions on the financial report?
Rhonda and I sat down with the State Board of Accounts, the person that's assigned to federal grants, and I have to say, all our handling of the COVID funds, we passed with flying colors.
Good for you.
Great job.
That's great.
Is money still rolling in some way, or so we're okay?
Yes.
Good. Health Officers Communication, Darren, Dr. Brucken?
Yep. We want to say it's nice to see everybody in person again. It's been too long, so welcome back. Obviously, everything has still been, business as usual with COVID response, and the vaccine response. And each time we meet, we talk about it and try to commend these people out here in the audience that have, on a day-to-day basis, continue to just do a remarkable job. So it makes it easy for me and the rest of all of us up here on this board to sit back and let them do the work that they're doing. So as always, I want to extend a thank you to everybody for what's going on out there every single day. And they haven't lost sight of the fact of the other things that they're doing, from environmentalists to vector control and everything else. So it's a well-oiled machine, and I think Rayla's put something special in the oil too, so it's been good. There's very few squeaky wheels out there, so helps all of us on the board look really, really good when we just do our job. So thanks again.
Questions for Dr. Brucken? Okay. New business?
It's just the establishment of our meeting dates for next year.
Okay. And then old business, please?
I had communication today with Deputy Auditor Cheryl Loudermilk, and I asked her if there was anything significant to share with the board regarding our 2020 budgets that were passed. The only thing that was different is Vector Control had put in for 2 new vehicles, and we were granted 1. And so outside of that, there was nothing. They all went through as submitted to you and to the county council.
And strategic plan update, Joni?
Well, I was shooting for September, and then we had our surge come along, so I just want you to know that I'm still looking forward to tackling this, and Dr. Todd and Mr. McCann having your help with it. I also wanted to bring to your attention that Ronnie Elder is no longer with us. She is starting her own business, and it's been a dream of hers since she was in her early 20s, and supposed to be the last of August that she was going to leave us, and it ended up being October the 8th because of the surge. But she's going to be sorely missed. She leaves the place a better place than when she took it over.
Will she be replaced, or will?
Yeah, I look for the position to be replaced. We're fortunate in our county to have a health educator media coordinator, and that person is also trained in crisis communications. So if something would happen in District 7 and one of the other counties would need the assistance of that person, it's been beneficial in the past. We're really lucky to have somebody who, plans and implements health education programs and does a lot of the collaborating boots on the ground with other entities.
Anything else from all business? Anybody have any questions or concerns? Okay. Program updates, Loretta? Vital records?
Vital Records is still staying busy with customers coming in, getting their birth and death certificates. Over the last 3 months, if you see on the report, deaths have went up, but births has went down. Due to COVID, the fall conference for Vital Records has been canceled again this year. And we are still waiting on the state to see if they're going to give us our back data back so we can start doing our own back data on our records instead of having to rely on them daily to do it. So we can still get our customers out more frequently than we already have. That's about all. Any questions?
Loretta, it seemed like a time when we reported births, for some reason we used to say in wedlock and out of wedlock. Is that?
Yeah, we still do in wedlock and out of wedlock.
Did we report it here? Did I miss it? Or?
I put them all together, but if you guys would like them separate again, we can. That's not a problem.
I didn't know if that was sort of the state.
We
one
just
reported
kind
that
of
way.
lumped them all together as one big number, but we can always go back to the way it was.
It kind of, sometimes it
You want it like that?
maybe.
Yeah,
I think it
absolutely. We can do it.
I think by separating it out, it does show us the trends that are going on.
The trends?
I can
Yeah.
remember Judge
Absolutely.
Elder pointing that
idea of
out.
The social aspects of what's going on.
Do you want me to go back?
Oh, no. No, that's
I
fine.
can, and we can send it to you. It's not a big deal.
Well, when sometimes I would tell people that, the different organizations do different kind of things,
Right.
and then I tell them, well, there are numbers in our county.
Like the
Show them
WIC
what
and
out of
everything
wedlock
for the
are almost the
programs.
same as being born in wedlock.
Right.
Which of
Okay,
course
that's
is a
fine.
paradigm shift in our parents' day.
Yeah, if you, I can work on it and get it to you probably by the end of the week.
Oh, no, next meeting would be fine.
Jess is here that does the birth, and we can work on it and get it to you, and
I
then we
think
can
just
start.
report it. I think maybe next meeting,
Okay.
3 months, just separate it, just kind of gives them a little.
Yeah, start like we did before. Yep. We'll get it done for you.
It's a determiner of, I think, of a lot of social issues when you look at that number. And it's kind of frightening, actually.
With the in and out of wedlock, how many is
It was
born?
like 50-50.
Oh, I think you're being generous.
Yeah, it's really, well,
So,
out of wedlock, a lot of that into, that's true. But
Ever since COVID hit, the dads have always been in the hospital a long time, or we're seeing a lot of the false price company
valid.
valid, therefore dads can't keep it on the record, license aren't valid either. That's why our appointments are going up.
yeah, if you could do
Yeah.
that next quarter, that'd be great.
Absolutely.
Loretta,
Yeah, go ahead.
what's the trend on your COVID death? Is it going down, trending?
Our
COVID?
COVID,
COVID.
you want the numbers?
Yeah, is it going down or?
Well, in July, we had 4. 2 of them were Vigo County, 2 of them were out. In August, we had 16, 7 of them were in county, 9 of them were out. In September, we had 43. 25 of them were Vigo County and 18 were out of county. That means that they live out of Vigo County, but they have passed here, like in one of our hospitals or a facility. So they are going up. That's why our numbers kind of went up over the months.
Vaccination is the same?
And with our COVID tracing, I'm a COVID tracer on the weekends. I would say that the people being vaccinated is getting very high. it's getting up there.
We'll go ahead and let we'll let the nursing
Yeah.
division discuss that.
We'll let the nurse, talk about that.
Are we still doing contact tracing, or that's out of the?
Every day.
Every single day, 7 days a week.
Yeah.
Yep. Any more questions? Good.
Thank you.
Okay, thank you.
Environmental, Amanda, please. Hello.
Okay, you guys have my report. We continue to stay busy in the septic division. The food division's wrapping up festivals and events for the year, slowing down on that part. We've had a lot of openings for mobiles. And then we've had several homes that we've had to investigate for unfit living conditions, along with some lead homes.
So how do you do that? Does the police go with you? Do you ever, I mean,
Well, one of them was actually a lead home, so we went out to do the lead risk assessment, and we got there, and we didn't feel it was safe for us. So at that point, DCS had been involved. So we took it upon ourselves to talk to them about the living conditions along with DCS, and we went ahead and tagged it because we didn't feel like it was safe for the children to be in the home. With the other one, it was also a DCS case, and DCS contacted us.
Do you feel at risk when you go there?
No. No, we usually go in pairs. So,
Well, I'm an old paramedic, and I went to a lot of houses in 5 years, and I never stood by the front door whenever
yeah.
I'm going to the house. But you know, everything else too, dogs, so be
Yeah.
careful. That sounds a little,
It's not fun. It's not the fun part of our job, I can tell you that.
They asked the home, one of the homes that they went into, if they had a dog, and where was the dog?
There was some in the bedroom.
The one in the basement that you had to ask about repeatedly, and no matter what.
Oh, yeah. Yeah.
dogs are,
Dogs, mice, roaches, you name it. The one house that was a lead house had so many roaches, the walls were kind of crawling, so, yeah. It had a lot of animal feces on the floor,
And a dead rat.
dead rat, feces in the baby's bed,
oh my God.
so, yeah.
Mandy, how's the fall festival lineup looking compared? Obviously, we shut down a lot, but then now this year, all the surrounding counties have
It's
put all
been
theirs back
crazy
on.
this year. It's like everybody's finding a reason to have a festival. Everybody.
Any violations? Did you have to not certify people, or everybody pretty?
They've been pretty compliant. We've had a few that we've had to ask leave, just because they didn't get their permit in time, but usually we try to work with them on that too. So, any other questions? No?
Thanks, Amanda.
Thank you.
Vector control, Mike, please.
Good afternoon. My season's winding down. Everybody else can say theirs is beat up. Mine's coming down. We sent in 99 different mosquito pools this year for West Nile virus testing. We had 6 come back positive. So far, the state of Indiana's had over 200 positive pools and has tested over about 2,200 pools. And we've had 4 human West Nile cases, and not in Vigo County, Dr. Turner. Vigo County had none. But in the state of Indiana, there was 4 cases, and they're investigating a possible 5th. 10 malaria imported cases. I knew you'd find that interesting. 1 chikungunya, imported again. That's about it. We sent in 10 bats and 1 cat. All came back negative for rabies. We've been staying busy, but we're winding down. Joni's about ready to give me more vacation.
Yeah, I know it.
Mike, have we seen Zika in a while? I've not seen
No.
a single report
No.
of any. Have you come across anything, Jeff? Or?
I was thinking about that today, Dr. Brucken. I've not heard anything all year about it.
It just kind of evaporated
Yeah.
from the news.
Yeah. And it's not been reported by the state, so
Yeah.
that's good. Any other questions?
I suspect the malaria cases were probably overseas travel or?
Yes.
College students?
Yeah.
From overseas? It's a hard diagnosis. I mean, people, you ever had a case? I've never had a case.
One case,
One?
St. Vincent's in Indy, so.
From where, I'm sorry?
I was at St. Vincent's in Indianapolis at the time.
From overseas or?
From overseas,
travel?
yeah. Yeah, actually a gentleman that had traveled from Liberia,
Is that right?
yeah.
Of course, our grandfathers who are still alive in the South Pacific, they almost all had malaria. They suffered with it for years, when they came home. And so now there's discussion about a vaccine that's being tested in Africa, so, because it still kills 500,000 children a year
Yeah.
or so around the world. What a great thing that would be to get a vaccine.
Definitely, definitely.
So,
So
They're still out there, mosquitoes are still out there, they're just inactive at this time of the year, so
What
there's-
temperature, Mike, before they become completely gone, mosquito?
50 degrees and they're completely inactive. At 60, they become lethargic. So at 60, they really don't bite because they become lethargic. At 50 degrees, they're totally inactive. At
They
30
die?
degrees, when we get a good killing frost, then that will kill them. They won't be done until we get a good killing frost.
Then there's springtime, then they,
Right, except for your culex species, which overwinter during the adult stage in your house or your garage or your vehicle, wherever they can do so.
there's no hibernation for mosquito. They're dead and they grow.
Yeah.
Nice to know.
They've been here since the dinosaurs. So,
Thank you.
okay, thanks, Mike. Thanks, Mike. Public health, please, from the clinic.
Hi, I'm Ann Stamper, and Ashley Stewart and I are implementing the COVID-19 vaccination grant. And I have our most recent vaccination statistics for Vigo County by gender, race, and ethnicity. You can see that we're now fully vaccinated. So what we've been doing is we've been doing a lot of Q&A sessions and clinics around the county. Our Q&A sessions have been really successful, especially at recovery houses and places like CODA, where we'll go in and we'll talk to people and answer their questions and concerns, and then, make them feel comfortable, and then they subsequently get vaccinated. We've done a lot of mobile clinics around town. Sometimes we'll go on site when people have room inside their building, and then if they don't have room inside the building, we borrow the mobile command unit from EMA and go out there. So I just left 2 clinics this morning. One was at Fox's grocery store, and right now there's one going on at the Sandcut Fire Department. And our most successful clinic was at West Terre Haute IGA, where we vaccinated 70 patients.
Oh, good for you.
And one thing that we have coming up that we're real excited about is we're working with the NAACP and Minority Health Coalition, and we're going to be at Bethlehem Temple Church this Sunday, and we're going to do a Q&A session first with Dr. Janie Myers, and then we're going to try to vaccinate some people. So do you have any questions?
Have you noticed any scripting that tends to work to get people to take the vaccine, or any strategies that have been super effective?
You just listen to people. I like to listen to people's questions and talk about that. Like if people, a lot of times they're worried about side effects or getting sick afterwards. And they just, want to know what their options are. I had one patient in a recovery center who didn't have access to news feed, and so he didn't even know, what are the vaccines that are available? What are the efficacy rates? What are my options? And usually if you just kind of talk to people and answer their questions, if they're on the fence, sometimes that's what helps them just makes them more comfortable to get it. But then I was at Garfield Towers yesterday after we vaccinated out at the Sacred Heart Church. And I went in there and I said, we have free COVID-19 vaccine available down the street. And people started saying, I heard that you're more likely to get COVID if you're vaccinated than not. And I heard about a case where it killed somebody. And there's just some people that are hard to reach.
I
How
wonder
about,
if go ahead.
How about the mandate? Are we implementing those mandates for companies? More than 100 employee company, it mandated.
About the company mandates?
Yeah, is that
Well,
implemented?
GE Aviation has implemented a mandate, a vaccine mandate, and they've asked us to come in and do a mobile unit on Friday. So that's what we're
Not
going to be
city
doing Friday
employee
evening.
is not mandated, right? City employee, employed,
City employees?
The city employee, you know, I haven't heard,
or Vigo
I haven't
County
been asked
employee?
about that.
Nothing? I
No,
don't
so.
think we're
No.
So President Biden pushed out the OSHA mandate. I think that's what you're speaking to, that
Yeah,
he
but
said,
I mean,
yeah, he
the-
charged OSHA with making a mandate by a certain date, but then they have to, that is in the process, but there's a bunch of legal turmoil going on around it, obviously. So once it gets posted in the rules of governance, I believe is the document that it's called from OSHA, you know, then it suddenly just takes effect type of thing. But they haven't even presented it for public review yet, so there is no timeline.
GE Aviation is a federally contracted company, and I'm assuming that that's the
Yes,
reason
that's
why
why,
they're
that's why they
mandating.
have the mandate. But yes, for the 100 employees and above mandate, that's still not, that's not, it doesn't have an effective date yet.
Union Hospital has a mandate, I think November 1st.
November 1st, yeah.
You guys think we've lost anybody, Jimmy? Do you know what's?
No, I don't think so. I don't think so yet. We're going through employees right now and checking everybody's status, so.
How about you, Darren? What's going on?
So HCA has not pushed forth a mandate, but several of our service providers, like my company, Envision Healthcare Services, we have a mandate November the 1st as well. Yeah.
Are you
I
sure
ask
that-
a-
Please, go right ahead.
I'm just looking at the rates again. So 50% is fully vaccinated in Vigo, is that it?
Yes, these are the statistics of Vigo County.
Is that, like, what's our goal, I guess? Yeah, I know that we're using funding, right, to kind of get the vaccinations out. Is there scientifically a goal, or we just have a goal considering our region? I don't know.
You know, our goal was to, under the grant, our goal is to increase the vaccination rate from the minority communities, 25 to 50%.
Okay.
Our goal as a nation, I guess, is herd immunity. What would that be, Dr. Brecken?
Yeah, I was going to say, whenever there's a good segue, I'll kind of speak to it globally. So we look at the infectivity value of COVID, we call it the R0 value, and we're trying to, the theorists say if we can get to 70 to 77%, then the R0 value should fall well below 1, which is where we want it to be. So the 50% of the vaccine eligible people are vaccinated here now, but then you got to factor in too the number of residents that have been sick and recovered, because they're not documented here as being vaccinated, unless they fall in that vaccine eligible stage, but then they have chosen not to get vaccinated even though they've recovered. The thing about natural immunity versus vaccine-induced immunity is, and Jim, please speak to this if you've seen anything different, the people that have recovered, they are not showing back up in hospitals sick. If they had the illness and have recovered, they are still demonstrating natural immunity. So it is holding, and it's holding across the country and even internationally. So that push towards vaccination, that's one big bucket, but the other bucket is people that have recovered. And we will never have a perfect idea who tested positive and who recovered, because many people don't get tested for a variety of reasons. They're sick, they're exposed, but they're not going to miss work, so they don't get tested. Yet they have natural immunity. So that number should always have an X factor that is higher than what we're reporting. Same thing goes for kids. The vaccine ineligible people out there, the amount of exposure and the natural immunity that's there in the UK study was just jaw-dropping. Couldn't believe the number of the kids that had neutralizing antibodies present, because they didn't expect that type of a number. There's a US study going on right now trying to track the same, basically just based on blood values. And I don't know when that data is supposed to come out, but the UK had anticipated about 20% of school-age kids would have neutralizing antibodies, and over 70 had some degree of neutralizing antibodies present in this, and I don't remember the age group, it was like 6 to 18. So it's kind of it's a hard number to get to. We'd love to say that 77%, which was that goal herd immunity number way back when in the Minnesota study. But, so we're at 50 plus X. We don't know what that X is. So, and it's probably higher than what we think, So we look at the national trends, we look at the local trends. The positivity rates are falling. We all hit that big Delta spike. Everything turned red, and now we're seeing pockets of oranges and pockets of yellow. Things are going the right direction. The hospitalizations in the last 2 weeks, everyone called for about mid-October to really start the downslide, and we got there about the 9th of October, and we started to slide down. The death rate
You know, as she pointed out, that's going to continue to hang on because the people that are in the hospital, the majority of those folks have been there for a while and are going to die in the hospital. And that's what we have seen. And Jimmy, you know, as your vent numbers have decreased, they've decreased not because people got off the vent and walked home, they all died. And that's the same thing that we've dealt with too at our facility, and the same thing with Indianapolis facilities and all of our surrounding counties. So we can celebrate the fact that the case numbers are going down and that the hospitalizations are going down. Expect that death rate to hang on for another 6 weeks probably, and then start to trend downward. And then it's, you know, like I said earlier to Jimmy, it's like standing on the ice. It's either going to crack or it's not going to crack. We'll see what happens. If there's another wave, some of the models have predicted yet another wave at the end of November. It has nothing to do with the holiday season. It's just the natural evolution of the variants and things. So,
Yeah, but with the anti-COVID pills that are coming, I think all the statistics will be, different, because these anti-COVID pills are taken by mouth twice a day, 5 days. That'll change the dynamic, but it kills the virus.
yeah, that's Merck's drug. It's showed a 50% reduction in hospitalizations, and the Regeneron, the monoclonal antibody infusion, in people that are positive and not sick enough to be hospitalized, reduces hospitalizations by 73%. So those two things, those two treatments are going to reduce hospitalizations and deaths, which is great. It will not have any effect on positivity rate, and we have to remember too that not everybody's going to have access to health care. And that's what's going on internationally. If we look at the poorest of the poor countries, there are countries in our world that have not even administered a single vaccine yet, not one stick.
But I think the pills will make a difference because there are about 3 or 4 companies making them, and it'll just be like Tamiflu, You get a flu, take some Tamiflu, and avert the severe consequences.
Yeah, certainly holds some promise. The FDA just backed to the mixing and matching of vaccines for the boosters, which is good because J&J and Moderna have just been waiting for their boosters. And so now we can mix and match those whenever they've backed it. They just haven't released it for us locally to start giving those J&J people a Pfizer booster. And there's some data internationally that suggests it's going to actually increase the neutralizing antibodies even 4-fold over a second J&J booster, which is pretty cool. It's a small study, but
I think the other question is, after 10 months next year, do we need another set of vaccinations? We don't know. If we keep the antibody against the COVID, then or we need a new set of vaccinations, just like the flu. Give it every year, So a lot of unknown.
As the pediatric vaccines become available and now technically approved, I guess, at certain ages, are we going to be doing that part of our immunization program? Are we marketing?
My
Do we have the vaccine
understanding is that it's the pediatricians and the typical pediatric providers would be doing those vaccines and not us.
We actually got an email today from the Indiana State Department of Health asking us if there was an interest in the vaccination for pediatrics. I sent it out to staff, and I don't think anybody responded.
Okay.
Andrea, you did? Okay, then it must have been late in the afternoon because I checked my email all day. But I think that it's something that we should do. And even if it's doing it in a manner like our old Super Shot Saturdays, where we took a Saturday and made it available for people, had city buses could fetch people with free passes. That's where our mass prophylaxis, at Terre Haute North and South, are where our mass prophylaxis plans are laid out, so we know where the outlets are and all that stuff and throughput. But I'd like to stand something up at the high schools in correlation with, or in collaboration with the school corporation.
Do we know what the vaccines, is it the same dose, or does anybody know?
Dr. Brucken?
Because we're giving children,
It's lower dose. It's
same
lower.
dose for children, because we're giving children the same influenza vaccine we didn't used to. They're getting the same adult vaccine. I understand, we used to give them a half a dose, and I think now we're giving them the same adult dose. Does that sound right? The pediatric population get the same influenza dose, not smaller for a pediatric population. So I don't know about these vaccines. In other words, it's going to take some little more a different dose or different calculation or more staff or they come in a different supply or it's all the same. I don't know.
Yeah, I haven't seen the actual data, but I mean, if you look at the biochemistry of the actual messenger RNA vaccine, it really shouldn't be dose dependent because of where it's scaled back from. The hyperimmune response that they saw in 2012 and the 2003 data that points, though, were a fraction of what those doses were in the early on trials. So, and really it's all about, you know, you get the inoculate in and then the dendritic presenter cells have to grab it up. So whether you get a load of 90 micrograms or 60 micrograms, it really shouldn't really matter. Other than you got some sore arms, but it's a shot. So.
And I think another thing the public asks quite a bit, can you get a vaccine and an influenza vaccine on the same day?
Yes,
And the answer is yes, but a lot of people didn't know we could do that or not.
we've been plugging it. County already started we've already started the county employee flu shot program. So far, a good turnout, but I'll let Twyla speak on that. Whoever's delivering the report this evening.
Can I ask one more question about?
Sure.
Because it sounds like you've got specific grant money for some populations you're targeting.
Yes.
Okay, because we're still sitting about 29% with African Americans.
Right. It has been very difficult to, so the important thing with the African American community is to gain their trust. And so it took us several months to get a hold of the president of the Minority Health Coalition. And we met several times, and they did ask us to come out to the George Ward Historical Marker event and vaccinate there. And I think that was very helpful to build our relationship. And so since then, you know, we've asked them to reach out to the minority churches and get us, you know, upon their suggestion, that would be a good way to gain people's trust. And so that's why we're excited to be out at Bethlehem Temple Church. And we have, the numbers are, we have made a 3% increase in the African-American community vaccination rate in the past 8 weeks.
Looks like Hispanic is kind of low too.
We have, yeah, it is. It is.
Does anyone know if we have much migrant population during harvest here? If many people come in
Probably
to
not
help with
in the county.
pumpkins or different things?
Maybe in rural areas around us, maybe.
And I don't know if that's a population coverage. I don't know how prominent it is. All here.
And we
Maybe not
have
much.
had a 6% increase in the Hispanic population vaccination rate in the last 8 weeks as well.
It does sound like even with kids, maybe assume that not every kid has a consistent pediatrician, you know? Because if they already use your office, if they don't, just to get the regular immunizations. So if you have the ability to have some of those doses, I would say that would be a good thing.
I would agree too, because the pharmacies are also taxed right now, which is another place they would normally get vaccinations. And I know from working in a family practice office, just having enough patients to get the vial, not waste, it's been difficult to negotiate. So I would endorse us doing one too.
You've been working very hard.
Yeah,
All
thank you.
staff.
Thank you.
And thank you. Yes.
I'd just like to take a second to throw a little shout out to some of the staff at Union Hospital, particularly in the monoclonal antibody treatment. The pharmaceutical staff and the leadership there just grabbed a hold of this and just developed a whole program and brought in people and locked up part of the hospital and developed this antibody monoclonal therapy that people could get. And theoretically, you were supposed to get between 10 days or so of your symptoms are being tested, but it got cranked up, and it was doing 24 weekends and so forth, and we were doing 25, 30 a day, Jimmy, maybe, or more.
Yeah, there were quite a bit at one
I
time.
mean,
Yeah.
first of all, if people were high risk over age 65, but later the numbers got down to could almost take just about anybody. And then as some of you may know, a few weeks ago, they developed, instead of getting an IV, they took about an hour, and you had to watch to make sure you didn't have a reaction. You could get 4 sub-Q injections. So we ramped up the convenient care clinic. I mean, I saw a patient there a couple of weeks ago on Sunday. We did a rapid test. So you walk into a clinic that you don't know anybody. In 20 minutes, you get a rapid test that's positive. He meets your criteria. Would you like to get monoclonal antibody? Yes. We walk him around the corner to another hallway, 2 RNs waiting there for him. He gets 4 shots of monoclonal antibody, waits for an hour, and goes home. That is pretty darn good. I would challenge anybody that has a system that's that efficient, that treats people so rapidly. And so I don't know how many monoclonal antibody treatments been given, but probably over 1,000 maybe. It's been a lot. And so anybody and it keeps you out of the hospital. That's the thing. Once you get in the hospital, you're in trouble. Gary knows.
100%, yeah, and that's,
Once you get that far, and Jimmy knows, once you get in the hospital, you're in trouble.
yeah.
So the system made an unbelievable push, and really money wasn't, we gotta just get it done. We'll figure out who gets paid and how and stuff like that, and it's going on today. You can go to convenient care if you go in there today, and you qualify, you can go around the corner at 5 o'clock in the evening, and that's pretty darn good.
Yeah.
You get tested, confirmed, see a physician, get an antibody, walk out in 2 hours. I don't think anybody's doing it.
And it's an amazing program, because these guys will attest that some of the disparities that we see, you know, the contract tracers, people get sick, and then we mention to them, hey, if your doctor talking about the monoclonal antibodies, they have no idea. They don't know what we're talking about, and that's disheartening, you know, that people aren't getting pushed that direction. So to fill that void, to be that stopgap and say, you're not even leaving the office until you hear about it is awesome. That's great.
What's the other thing I found interesting is people are willing to get the monoclonal antibody experimental, but don't want to get the vaccine experimental. They'll go right to the monoclonal antibody without a hesitation. You know, it's kind of like buying car insurance but not having any brakes in your car. You know, what you're missing the whole point. You know, get the vaccine, you don't have to get the monoclonal antibody. But they embrace the experimental antibody, but not the vaccine.
It's the Joe Rogan theory.
I'm sorry?
It's the Joe Rogan theory.
Yeah.
First the vaccine, and then sign up for anything else they'll throw your way, so.
But Jim, but at the time that they were tested positive, they cannot get the vaccine right away anyway.
No, but we're
So you
covering
have
them
to-
for a while. I mean, we're getting them a
But
good
if you get
slug
the
of antibody,
monoclonal,
right?
you know, they think it's a treatment, you know,
Yeah,
so.
and they will not end up in the hospital. The numbers are just powerful.
Yeah.
How many clinics that is doing that now?
I think pretty much
Just you
union-based
guys. Yeah.
in the convenient care clinic that I know of that has it going like
Yeah, I
that.
don't think anybody else does, because the monoclonals are basically antibody, are hospital-based, the infusions are, so you have to have a hospital base to do it at. So to do the sub-Q is, I know we're not doing any sub-Q at regional, any outreach, so.
But an amazing ramp up by the leadership and the pharmacy staff to put that all together so quickly.
Yeah.
So efficiently, and it works.
They really did think out of the box quite a bit on that too, because right now we're in staffing crisis with nurses, and so they actually brought in a lot of Terra City paramedics to come and do that as PRN employees. And so then you have people that are already used to taking care of people in the community, and they're working PRN shifts, coming up and starting IVs and doing the monoclonal and they stood that up really within about 5 days of the first plan to do it, so.
And it's still going, so people can still get it.
Yeah. It'd be nice if you guys could pilot that program with all the ERs around.
I have not seen anything in literature that anybody's done anything like that. You can get seen, tested, treated, and walk out the door for free.
We've
Well,
been,
taxpayers.
yeah, we've been doing it when we capture somebody in the ER at regional that doesn't meet hospitalization criteria, then, you know, we don't let them out the door until we speak to them about the infusion. We set them up for the appointment the following day. We still got about a 30% no-show rate the following day. They change their mind, they feel, oh, I'm feeling better, and then they come in 5 days later, and then they're sucking mud, and then they wind up with me for 37 days and die.
So I think overall, as a community, we can be very proud of our effort. You know, the medical community, the health department, the citizens, the volunteers that stepped up. I think we can be proud of the effort that we had against COVID. I think we did as well as anyone, right?
Yeah.
Anybody's done what we've done.
And Dr. Todd, you asked earlier if there's a message or a way to speak to people to try to increase the vaccination. And I'll say from my standpoint, from standing by the patient's bedsides at the hospital, the family members, when they see it, everybody wants the vaccine. And then when we hear things about vaccinated people still testing positive, the misinformation is, well, what good does it do for you? And if you look at the data that shows the hospitalization and the death rate, still 97% of people that are hospitalized and that ultimately die are unvaccinated. So I try to impress upon my family members that come through, it's not to protect you from getting COVID, it's pre-treatment, essentially. You know, this is how you beat this and stay alive, with your neutralizing antibodies laying in wait. So, and I noticed that the federal government now has finally started putting out more heartfelt PSA. I don't know if you guys have seen any, in particular, I've seen one with an African-American man who was in the hospital in 77 days and had a trach and died 3 times, and, you know, powerful messaging from the other side of it, which, I wish that was going on more. I wish every single commercial, wasn't a beer commercial or something for Ford truck, but was that testament from I got through it, but everybody else didn't type of thing, so.
Your social media presence, I think, is well done, too. I don't know who does that, but somebody probably has to monitor that, the visuals of this many people hospitalized, and vaccinated, unvaccinated, it's just a very good, simple visual. So,
I agree.
yeah. Who does your social media?
Ronnie has always done our social media. Beth Morris is stepping in and doing that at the interim time till we get a position filled.
Was there any citizen input this evening?
We still have nursing.
Oh, I'm sorry, excuse me. I missed somebody. I apologize.
We talked about a lot of what was already on our report, so are there any other questions?
Andrew, do you want to speak to the whole back on track thing that's coming?
That's actually Twyla, if she'd like to come up as well.
Dynamic duo.
So the Back on Track, that was listed as a future outreach, which is going to be Tuesday. We're going to open it up to the community. There's already been some advertising going on. It's going to be Tuesday from 3 to 7. I don't think you have anything other than that's what we're going to be. We're partnering with MedWise and Indiana's Department of Health, and then the school systems as well. So it's an outreach because regular immunizations for childhood vaccinations has suffered because of all the COVID. So like even on our client visits, our client visits overall have increased. A lot of it is COVID related. So on the very front, it says that our total, including vaccination, COVID vaccinations was 3,430, but 1,014 were regular visits. So we're hoping with this Back on Track, MedWise is really sponsoring it. They're going to be going to different counties. We're the second county in the state. So far, they did Allen County first. And we're reaching out to kids to come and get vaccinated. They don't have to register. They can show up. And they're making it a fun experience. There's going to be a bounce house here. There's a raffle. They're going to have prizes for Amazon gift certificates, $50. Every 30 minutes there'll be a drawing for that. There's also, I think, a laptop that can be won for the whole day.
Food truck.
Yep, there's going to be a food truck. There's free food. So if you know anyone or want a flyer sent to you in particular, let me know, because I've got that. So we're hoping for a good turnout, hoping for good weather, and hopefully get the kids' immunizations back up. And then there's going to be a webinar with Dr. Brucken the evening before. Patrice Dayton is going to be interviewing Dr. Brucken and a few others about childhood vaccinations, and also highlighting that this Back on Track is going to happen the next day.
She's done an amazing job.
Thank you very much.
Thank you.
Okay. Now, citizens, everybody done? Citizens input? Anything from the board members, questions, final concerns? All good? A motion for adjournment? Second?
Second?
All those in favor? Aye. Opposed? Next board meeting, January 19th. It'll be winter and we'll be unhappy.
Mosquito free though.
That's right.
Thanks, everybody.
Thank you, everybody.
That'll be January. So there, I know. Yeah.
I'm going to retire promotion. It's been 3 years. So, we're still going to